Calls to the Metropolitan Police about mental health have risen by almost a third in 5 years. Figures show there were 115,000 calls with a mental health element to London's police force. In the 12 months to July, that compares to 86,520 in 2011-12 and equates to about 315 a day. Call-outs included to people involved in or suspected of crime, those in crisis support to other emergency services and local council health assessments. 40,000 of the calls had a police unit assigned or sent out to them. The detail showed the calls were a mixture of emergency 999 and 101 calls. Of those, 13,000 related to mental health hospitals, of which 4,000 have a unit assigned. The Met received almost 5,999 and 101 calls in the same period. Commander Richard Smith, head of safeguarding at the Metropolitan Police Service, said 1 in 4 Londoners would experience a diagnosable mental health condition in their lifetime, and that include the large number of people held in custody who would need an assessment and a care plan. Use of Section 136 of the Mental Health Act was also up. The emergency police power to take someone into a safe place when they are out in public. Police said it was up about 10% each year, and could double in London during the next 10 years. The Met can take up to 400 people detained under Section 136 to a place of safety each month. More to do. Labour's police spokeswoman Louise Hay MP said people on long waiting lists for mental health help were turning to the police as a service of last resort. While facing a savage cut in numbers, the police are increasingly being asked to pick up the pieces of a scandalous lack of mental health provision, she said. A Department of Health spokesperson said there had been major improvements to mental health support in recent years, including setting up access and waiting standards and increasing spending to £11.6 billion in 2016-17, but the spokesperson said there was more to do, and the government was working with NHS England to improve access to services across the country.